So yeah, that's excellent. So yeah, it's 2 minutes past. So if you can just keep your eye on the lobby, Josh, and
Yeah, not a
I'll
problem. Yeah.
do a little bit of a slow introduction. So thanks everyone for coming. This is obviously part of our Tech Week set of webinars. I will drop something into the chat for you to look at our other webinars that are on tomorrow. We've had a couple already and the Tech Week's going really well. So we really appreciate your time. The recordings will be available after this, and we'll also pop them onto our Connect page for our internal staff as well. But you should all get a copy of the recording if you're signed up for this webinar. If you can use the Q&A function rather than the chat function if you have got any questions, and then we'll be able to respond specifically to those questions. And if there's any questions that come up in the Q&A that we think could be really helpful to share with other people, then we will bring that up at the end. Josh, a couple of people have said they can't hear anything.
Just having a look
Can
at
you,
the settings now. Yeah.
Can other people hear me?
I can hear you.
Yeah, I can hear as well.
I can
You
hear.
can?
Yeah.
Yeah, I can see some thumbs up.
Yeah.
It might sometimes be with settings.
Yeah, I think perhaps
nothing jumps out in the settings at my side.
Yeah. Okay. Well, if there's some internal people that can hear and some external, then
can I just suggest for the person who can't hear, if they just log out and log back in again, it might resolve the problem.
Yeah. Thanks, Mel.
Yeah.
Brilliant. Okie doke. So I'm going to hand over to two colleagues from the TSA, which is the Tech Services Association. They're the voice of technology enabled care, the industry experts in our field, essentially. Charlotte and Gemma are going to talk to us about the opportunities within learning disability, autism and mental health services for improving independence and choice. So if you're okay sharing slides, Josh, then whichever of you guys are starting, you can take control and we're ready for you.
Fantastic. No, thank you all. And it's going to be a little bit of a tag team today, everyone, between Gemma and I. And I know we've got the next hour or so, but I promise it won't be 55 minutes of us talking to you. It will be, we are going to just go through some slides, very informal. It's very much just wanting to share with you all some updates and just really some different examples of what we're seeing from a TSA perspective, kind of across the whole of the UK, but really as Natalie's mentioned, with that focus on zoning in on how we use technology enabled care, or how we can use technology enabled care in those areas and for those individuals with learning disability, autism and or mental health. But before we jump into that, we will just do a bit of an intro to who I am and who Gemma is. So if I just move on to the next slide, please. And whilst that's switching over, so myself, I'm Charlotte Finlay and Head of Membership Services at TSA. The role that I play at TSA is, I think I will have spoken to some of you on today's call, but is fundamentally supporting all of our TSA members, which we have around 360, that sit between organisations like Derbyshire and Mediquip, for example, that are providing or commissioning a range of different tech-enabled care services. And we also then have members that sit on this supplier or solution provider side. So we get really kind of in the middle of understanding what are the challenges and opportunities that we see across our whole social care, social housing and health sectors and where can technology play its role, and also how we then just join up those dots to really kind of enable our sectors to move forward, addressing some of those, as I say, those challenges, opportunities, and we sit right in the middle of that. But I'll hand over to Gemma so she can give a quick intro on herself as well.
Thank you, Charlotte. So I'm Gemma Oliver. I joined the TSA in January of this year. Feels like I've been here for much longer than that, as my previous role, I was within a alarm receiving centre within a housing association, there for 4 years, and worked closely with the TSA and the tech quality, doing the quality standards framework auditing, which was fantastic. So lovely to be here and hear from the other side of the coin. But if you want to drop in the chat where you're from and say hi, that would be wonderful as well, just to get a feel of who we've got on the call.
Fabulous. Thank you, Gemma. So just really to kick off and moving on to the next slide, please. I think just to give a little bit of background context. So as we've kind of given a flavour of who TSA are, we are a not-for-profit industry body, and we work with, as I said, a range of different organisations. But our real kind of focus role is how we take technology and how we start to embed and utilize it, but never it is to replace the role of those warm hands, those individuals that are delivering care day to day, or whether that's any form of frontline services. But what I think, as we are, I suppose, all aware of some of the additional challenges, whether that's from funding cuts, whether it's from recruitment shortages, we have to be exploring how we deliver our services in different ways, in utilizing technology to enhance our service delivery, to enhance the level of quality of care and support to a whole range of individuals across all ages, but as well as how our workforce is then supported to be more efficient, how we can relieve some of the pressures that are no doubt on some of you in your day-to-day roles. That's where we want to be as TSA, kind of driving that work of technology as a whole. And for today, as I said, we're going to zone in, looking more specifically on the areas and services that span across learning disabilities, autism and mental health. And without reading kind of word for word that's on here, and just kind of a side note, Gemma and I have put quite a lot of information into today's slides, and that is more for you to take away, use after this, and more as just as reference points. But I think what we wanted to start with is just setting the kind of how the land currently lies when it comes to the use of technology across learning disabilities. And there's some examples on the screen at the moment around some survey results that was completed by TSA alongside PA Consulting. It was originally done in 2024 with a follow-up in 2025. But that started to pull out how from leaders within adult social care services, so our DASs, what are their views around the use of technology, and more specifically, how are they either currently using technology across different service areas? And you can see here there was a strong percentage of around 60% of responders. It said that they do use tech occasionally to support people with learning disabilities. So I think that occasionally is the key word there, because what we want to try and start really evidencing or seeing more of is how using tech across our LD services just becomes the norm, or how we can start to really enhance that percentage in it, as I say, start to really drive that as a business as usual. I think where we're seeing a lot of that kind of the opportunities around tech in LD services really start to drive from is there's a lot of focus on how, for local authorities specifically, LD services are one of the most cost costly areas for local authorities. So again, as we know, with funding cuts really kind of being driven down at the moment and all of those funding pressures, there is that focus on those areas for local authorities that are in that kind of top cohort for cost. How can we be working differently? And one of the areas to kind of go drill down on that a little bit more is you'll see an example here, and it's a really great case study. So I would recommend kind of going on the link that's on the slide. So Glasgow City Council, they'd identified that one of their areas that they wanted to focus on was night support, and more specifically sleep-in carers. So they worked with an organisation called Care Builder, and they had a cohort of around 101 care packages. And you can see on here, we pulled out that they had the annual savings, which was a huge amount for this particular pilot that was delivered, and that's now gone into a rolled out program. But I think it wasn't just around the annual savings that was the benefit. It was around that impact on the workforce, that change management, that culture management, and fundamentally it provided more independence also to the individual. So it is a great case study, and that's what Gemma and I are here today, just to kind of share with you what's going on outside of your region and your locality that you can maybe take away from today and go, that might be something that I want to look into some more to see if I could maybe fill a gap or a challenge that we have internally, and look at how we can explore that with the use of technology. Moving on to the next slide, please. So when we talk, and this is at TSA, and I think a lot of our members talk in this way too, when we talk about building a tech-enabled strategy. I know Natalie's been doing some of this work internally as well, so she might recognise some of this from the tech strategy for your authority. But it's really important to kind of build in these building blocks, because as I've mentioned, and you'll hear TSA really kind of hone on this, it isn't about the technology. That kind of is the easier part. It really is about how you embed that technology into a service provision, and thinking about how you build that vision in leadership. And it has to come from, when you think about yourselves, or whether that's a local authority or a care provider, it's how you can set that vision, whether that's a top-down approach, thinking about what do you want to achieve with technology? How do you really want to enable individuals to thrive, really support and empower your workforce? And it's thinking about that leadership. And then you want to really kind of get that going across all of your areas, whether that's from commissioning, whether that's really working in partnership with your suppliers, and driving some of that leadership with them. Because if we go back 10, 15 years ago, it was a very reactive style of technology that we worked with, very transactional relationships that we worked with tech suppliers, whereas now we need much more from our tech suppliers. We need to be partners with them. They need to be helping us to really create that vision internally. So I think that's something that TSA is really wanting to see more of our service providers and local authorities driving some of that change with the work of building those tech strategies. We always have to think outcomes focused. And I know you probably hear this phrase so much, but it really is true that we don't want to create that view or a little bit of a stigma where it's a technology first approach and the technology is all that we think about. It really is thinking about what is that outcome that you're trying to achieve for that individual, or what is that challenge that you're trying to mitigate that risk, and working backwards from there to develop an approach that really does encompass that outcomes, and that kind of keeps you on track of knowing if you're making that right decision. Because if the technology is not going to enable you to achieve that outcome, then it's not the right technology for either you as a service provider, or certainly not for that individual that obviously has to be at the heart of all of the decisions that we support them to make as part of their assessment journey. Co-production and co-produced is another key area. I think, excuse me, it's just so fundamental. And I think sometimes we see co-production and that is, oh, we'll do a survey of asking individuals what they want from tech. And as we know, that's not really true co-production. It's about how you start to really bring in the views of the individuals that are in receipt of care and support services, their family members, their informal carers, yourselves as the key part of this in terms of that workforce that are providing the services. How can that all of your views really kind of encompass to help deliver that strategy? And I think as a sector, co-production is something that we can definitely do more of. And I think that's something, you know, at TSA, we're looking at how we can support or provide guidance to our members to really drive that co-production view. So if it's something that you'd like to either get involved more with or understand, how do I deliver co-production well, let Gemma and I know. And there is some examples out there that would be absolutely more than happy to share. And then I've talked a lot about workforce. I don't think this goes without saying, but without taking your whole workforce on this journey, if you're wanting to really embed tech-enabled care, it will fail without really getting that backing from the workforce. So I think it's really important that we're addressing, if you want frontline staff to go out there and promote tech-enabled care, or you as an individual are being asked to go out there and promote technology, really kind of speaking up to say, I feel like I can't do that because there's maybe some training gaps, or you don't have the confidence in the tech yet. So I think it's really important how, as an authority, as services, there's that level of understanding and honesty when it comes to how do you be supported, and how do you ensure that you are empowered to play your role in driving the tech agenda. And lastly, this is the little bit that we always have to touch on, and it kind of is the hardest part. But when it comes to benefits realization, so this is all around, we have a little bit of an issue in our sector where we have some fantastic pilots, and then you've probably all been involved in them, and the pilot is great. And then it stops at the pilot phase, and it never really goes into that scaled approach or that business as usual. And sometimes one of the key failings and one of the contributing factors of that is there hasn't been that focus on measuring the impact, gaining the evaluation, and really demonstrating what that benefits realization was of that process of bringing in that technology to support as part of that service offer. So there are documents out there. We can pop a little link in the chat. There is something TSA worked with ADAS on a proactive and preventative commission, and that was all around how we're starting to understand, how do we create that blueprint approach, that benefits realization on driving that impact levels and being able to evidence that. So it's a long read, but it's a good read. So we'll pop that link for you all in the chat, but we definitely recommend, because without getting this gem, that's where, like I say, we unfortunately don't see that business as usual coming through into our day-to-day delivery. Next slide, please. And I've talked about kind of some scene settings there with a few little examples, but I am now going to pass over to Gemma just to give you some more examples wider from some of our members at TSA, and just kind of really drill down on some real life examples where we're seeing some great work take place. So I'll hand over to you, Gemma.
Thanks, Charlotte. So Telford and Wrekin are one of our members, and we're sharing these slides on their behalf just so that we can share with you some fantastic work that's happening. Giving you a little bit of background, Telford and Wrekin were struggling with pressures during COVID, like most people were, and noticed that there was a need and an opportunity to put technology-enabled care into place. They did some market research, they looked at all the various options, and they chose Ethel Care, and to do a pilot with them. They got secured funding for 3 years, and they're still within that 3-year process. So the things that I'll be talking to you about, they haven't reached the end yet. So I'll explain more about that in the coming slides. But the full plan is that it will be self-sustainable at the end. So how's it going? Did I just move the slide on? Did I do that myself? I did. Wonderful. Great. So the pilot is showing that it's so important, like Charlotte was saying before, to get culture change from the beginning, from the top senior commissioners all the way down. You need to really be working together as one to make sure that this isn't just purchasing a piece of tech, plopping it in and leaving it, because it will fail and it will fall flat, because it's an ever-going approach to be able to build on that. And we're looking at individuals. It's not a one-size-fits-all. They're bespoke and they're made to be changed to make sure that they're meeting the needs of that person and getting the outcome that that person needs. You can't just hope for the best. We know that people with learning disabilities, it's going to take longer to embed the technology with them. They need to get that repetition going, and they need to learn those new skills in order for it to be successful. So sometimes these pilots would need to be running longer than you might do for another person within adult social care. Bear with me. So what have they learned? Again, it's learning that everybody needs to adopt these brand new behaviours. You need to invest in the education of all of the different types of technology you're going to be putting into place, and also working together, sharing examples of where, through another colleague, where you may have put something into place and you found it really successful and it's worked, and then challenging each other as well to say, have you thought about putting this in for this person, because we've noticed the benefits with another one of our people that we're using it for, and celebrating those successes. Because we can quite often do things and we think it's just what we do, but you're actually doing such incredible work. It is really worthwhile sharing it. And like we are today with what Telford and Wrekin have been doing, it allows other people to build on what they've done and think, hey, we could do that too. So we always want to be sharing those good news stories, the success, and also the challenges that you can recognize and not perhaps make the same mistakes. You'll know how to do things differently the next time. And we also want people to think about individuals, sitting down with them on the sofa and getting to really know that person and what their life goals are and what they want to be able to achieve. To not just put something in for the sake of it. You want to make sure that it is actually going to benefit them. They're going to be able to use the technology, understand it, and there is going to be an overall positive outcome at the end. So let's move on to a case study example. So this is a person called Andy, and Andy had severe anxiety and was putting in lots and lots of calls to carers every day because he was really unsure about what he was going to be doing and how he was going to be spending his time. And then by using Ethel, he was able to map out his own day, putting in the activities that he wanted to be able to do, like go swimming, go to Greg's, and just experiencing that independence to make the decisions that he wanted to make about his own life, which in turn reduced the amount of calls he was putting in, reduced the social work time that it was taking, and he was so excited to also be able to share with his parents how the technology worked and how he was able to be more independent with planning his own day, which was fantastic to see. We've got a case study with Ben here as well. This is slightly different because most of the case studies are more to do with learning disabilities and autism, but Ben actually also suffered from paranoid schizophrenia, dementia, and COPD. And it was a really sad case where he was put in a mental health facility completely away from his family for 13 years because they felt that he wouldn't be able to live independently and required 24-hour hospital care. Again, Ethel was used and was put in, and he actually moved into accommodation with carers on site. Ben was then able to use Ethel to set times of the day where he would be recording and monitoring his own oxygen levels. He's still learning. Like we said, it does take a bit longer for people to understand how to use and build the carer's confidence, but it's now meant that Ben is out of that 24-hour facility. He's back within Telford, close to his friends and family. He's able to have that autonomy to take some ownership of his own health. He's very happy to be living independently. And one of the major things that's come out of Ben's case study as well is the total cost savings. And that's looking at just over £40,000 per year. So we can see how these pieces of technology are really making not only that impact on the individual, but savings for the authority as a whole as well. Now got a little video from Debbie, who is a service user, explaining how she's been using the technology. Hopefully you'll be able to hear this. Please flag up if there's no sound.
We've got sound, thanks.
So that was Debbie showing how the technology actually works for her, talking her through how to do recipes, how to build on her independent skills, how she can have those medication reminders and the check-in just to say, how are you feeling today? And when she says not so good, then that signals for a support worker to get in touch as and when needed. And then the end goal for her is to build on this learning and live independently. So next we have Amy. Amy is currently living at home with 3 other siblings with learning disabilities, and mom is the main carer for all of them. And the main thing here was that Amy wanted a mom to be her mom and not just being the nag telling her what she had to do when she had to do it. She wanted to be able to free up time to just spend and have that mother-daughter relationship again. So again, by incorporating this technology in through the Ethel app, Amy's been able to take her own medication, do her own laundry, eat at the right time, and it's been giving her that routine and the rhythm and balance so that she can move forward to live independently once she's ready. And it's allowed her mom to, again, just be her mom, have that time to spend with her siblings who also need a lot of care, but give Amy that independence that she's been striving for so long. So another great example of how it's working in real life situations. So looking at Andy, Debbie and Amy, like I said earlier, we're only in the second year of this programme running, and it is a small service, but we can see that so far we're looking at £164,500 per annum savings. So Ethel is doing a fantastic job, not only for the cost savings for the authority, but also giving that independence for each of the people that's been using it successfully. Now, there's not just Ethel out there. We just wanted to touch on another product from Abilia. I know this is very small, but when you get the slides, you can have a read through it later. And Abilia, it's using the Memo Planner, which is a cognitive support system, again, for scheduling, reminders and tracking. And we've had successful cases. We've got Noel with Down syndrome and early dementia who's been using it and has reduced 2 hours daily of care. We've got Sam, who's had a lot of anxiety, again, about management of time and difficulties and anxiety. Again, that's working really well for him. And Kai, with limited verbal communication, is already supporting communicate much more effectively with his carers. And we can see from here that there's already a projected over £40,000 worth of savings in reducing care costs by using this as well. So again, there's a lot of technology out there. It's finding the right one to suit the people that you're working with, but the cost savings are becoming evident. So I'm going to hand back over now to Charlotte to take us through the next slide.
Perfect. Thank you, Gemma. And I think we just wanted to kind of take a little bit of a more steer on how tech's used across more predominantly mental health services. I think to be really, really transparent, it isn't used as much as it could be. I think that goes without saying. That is the same for LD services and autism as well. And I think, you know, one of the things that it's fantastic having a session like today is because it kind of gives us that opportunity to go, there is some great examples out there, but they're in like small pockets, I would say. And what we really want to see is just that more enhancement of tech used. So that when Gemma and I and our and our colleague Charlotte Downing started really preparing and looking into kind of what's going on out there ahead of today's session, one of the major things for tech used in mental health services came up was apps. And I think that probably, you know, we need to think about, sometimes technology isn't always about a physical, you know, device or a wearable. It absolutely can be the use of apps and how we can use maybe more accessible technology. So it doesn't have to be a specific device from a specific supplier. It's if you've got an Android or an Apple phone, you know, can we maybe drive tech adoption in the use of some of these kind of app-based technologies, because it's on an individual's phone. They're used to using that every day. So sometimes for the ease of use, it's actually a lot better to go with that route first. And that's kind of a lot of the feedback and research, what we've been doing, speaking with some of our members, is the first step of introducing technology across mental health services. That first step has been to use apps. And I'm not sure if any of you are aware, but we did put a reference on to the Orca Health's website. So Orca are a fantastic organisation, and they audit and provide a lot of guidance around apps that are out there now that are currently being used across a range of different cohorts, conditions, but they do have a lot on there around mental health and well-being apps. So it's a great reference guide, even if you used it as that kind of first port of call. So definitely one to have a look into. We also see, and so Gemma touched on a lot of examples of how individuals are using technology for those daily reminders and daily prompts, which what we found is, so Torbay Council, for example, they're using a range of technology, whether that's from sensor-based or just some proactive calling out through their alarm receiving centres. But that is around daily reminders on living tasks, whether that's medication prompts, whether that's prompts for bathing, for eating, and they have used that rolled out across their mental health services. And what they've seen is that impact level is that reduction in anxiety, and fundamentally, I think increasing that autonomy, which is absolutely what we want from all of this that we've spoken about today, is how we drive that greater independence for the individual. So there's just a few, I suppose, little areas that we've seen come through from mental health services, but we absolutely want to be seeing more. And I think the other thing that we've talked about is what we don't need to be doing is thinking about technology and putting them in a kind of focused or closed individual group or client group. So what we need to be thinking of is how can a technology, whether that's like the memo planner from Mobilia or the SL Care device, how can that just be used across an all age approach, whether that's children's services, whether it's LD, mental health, autism, or older adults? How can we really just drive that we're looking at a piece of technology and go, this could be used for anyone if we make it personalised and if we really think about those outcomes that we want to achieve. So that's something I think as a sector, we're not quite there yet. But I think the more and more we have of these conversations, share some of our just kind of shared learnings and challenges, but with that view of how do we just make all technology accessible to all, is definitely what, from a TSA perspective, as as that industry body that needs to be driving some of this, what we want to be pushing on. And now I felt silly because I didn't realise I could change the slide on my own, which I can do. So there we go. And I think, just as we've said, this is more of a slide absolutely to take away, but we just wanted to pull out of all the different examples we've spoken about today, where are we seeing technology bring benefit? And as we've said, that is all around prompts, reminders, whether that's on daily living activities, whether it's managing behaviours, certainly around some of those more passive monitoring. It really doesn't need to be in your face. I think it can be very much in the background. That's what we see is driving that autonomy and independence. It can really, really help with social isolation. I think, we talk about technology for all of us helps to improve social isolation and remove some of those barriers. And that's certainly for this cohort of individuals, what we see is a really big positive outcome. And then certainly that how we start to blend those hybrid and floating support models around bringing together technology and the physical delivery of in-person care that cannot be replaced, but getting that blended model, I think, is certainly key. And what we'd hope to to see if we come back to do the Tech Week next year is that this particular slide is filled with a lot more different impacts and outputs and ways that tech's being utilised. But I think these are the core areas for now that we've seen it's starting to really gain that attraction. And to just bring everything, I think, to a little bit of a close, what Gemma and I really just wanted to bring back is these 3 points. And everything that we've spoken about today, it can feel, quite a lot of information. I think when you're certainly starting to think about what's the right technology out there, whether that's you're choosing it for yourself, whether you're choosing it for a loved one, whether you're working with an individual that you support and you're looking at their care plan and their assessments, you can, there's a lot of shiny kit and there's a lot of great technology, but I think you've got to really bring it back down to these 3 areas. And that is how you build a tech-enabled care offer that supports individuals to thrive. We believe is based on 3 key areas, and that is co-production, personalised or personalisation, and it being outcomes focused. And what we'd say is if you have these as your core foundations when you're building those strategies or making those decisions, then this really puts you as that in a really strong position in making sure that it's going to be a success. Because we see time and time again, technology is bought, it sits on the shelf, it fails. Sometimes that isn't down to the technology itself. It's because it just was made maybe not on informed decision making. It wasn't the right fit for that individual or that service. And then it gets that stigma of, oh, well, it was just a waste of investment or a waste of money. And we really want to remove, from repeating some of those similar mistakes that we have all made before when purchasing technology. So hopefully these 3 pillars, if we can, get them all in your minds, is certainly what we wanted to leave you with today. Now, that is it from us. And we did put these 2 questions on screen. This is maybe something for you to take away and think about with your internal teams, or if you've got any thoughts on it today, Gemma and I would be more than happy to answer any questions or even just have a discussion around these areas. But I think it's really important we start to think about, if you are out there seeing barriers to introducing tech across LD, autism and mental health, what are those barriers? How can we work collectively as a group to help you address those and trying to remove them? And on the flip side of the barriers and challenges, it's what opportunities maybe do you see day in, day out that you think actually technology would play a great role within that area? So like I say, Gemma and I will be quiet now. We'll hand it over to you guys, and more than happy for any questions or comments, and hope you can take a little bit of information away from what we've shared today.
Thanks so much, you two. That was absolutely fantastic. And hopefully you've all got a lot out of that, and a lot that you can take back into your team's thinking. In terms of the technology-enabled care services in Derbyshire, both Ethel Care and Abilia were at our event, our tech marketplace event on Monday, and as part of our tech strategy, we are going to be looking at sort of supporting people with a much wider range of technologies, and looking at our overnight care and how we can support people in our LD services in a slightly different, more creative way, more empowering way. So we will definitely be looking at products like the Abilia and Ethel Care to bring into that way of thinking. So watch this space on that, and please get involved when we do. There's lots of questions. They're all going into the chat rather than the Q&A. So just let me answer the Q&A question, and then I'll come into the chat. Tanya, our assistant director, has asked if there's an age limit to Ethel, and thankfully we've got Deepak with us today from Ethel Care, who's expertly answered that on our behalf in terms of no, there isn't any age limit on that. They've worked with younger people all the way up through that spectrum, and from what I've understood of those types of technologies, it can equally be used for people with cognitive impairments through things like dementia, brain injury. So it kind of has that really wide reach there. Let me go to the chat. So Michael, who's one of our learning disability and autism navigators, has said that a barrier is the confidence of individuals in working with people, and the understanding of what people with a learning disability and who are autistic actually need. But the opportunities are enablement, greater independence, and confidence.
Absolutely.
Yeah.
do you want to come in on that, Michael? Please feel free to jump in if you wanted to say anything else on that.
Just that, the barrier is being aware of the technology, and then having the confidence of, when you're working with particular groups, to go, actually, have you thought about using this? Let's have a look at how this can implement for you, because it's very easy to fall back onto what you've always done, because you know that this is what we've always done. So let's stay with this, because you, as an individual, you need to have confidence in what you're doing, and confidence that you will be backed up, etc., to be able to then try these more innovative approaches that are outside of what you've previously done.
Absolutely. And I think that's building on the education within teams as to what is out there, the sharing of that best practice and what's been working, so that you've got examples. And like today, giving you the opportunity to see what's working in other areas, that you can have some confidence that it's been successful, it's working, and having that opportunity to network with those people, to talk to them and say, tell me exactly how you went about doing this, and getting that buy-in, like we were talking about, from the very top all the way down, because it has to be that approach where you're all working together. But yet it's absolutely a barrier at the moment, and something that we're trying our hardest at the TSA to try and hammer down and get everybody thinking that there are options out there, and we don't have to be scared of technology. It's not trying to replace everything. It's there to support and scaffold the additional work that the carers are doing.
And onto the confidence to fail as well. Because that's really important. Oh, it hasn't worked, that's okay, sometimes it doesn't, but the confidence to acknowledge that and be able to move on and try it again and so on is really important as well.
And able to say, just because this one particular thing hasn't worked, let's rethink, remap out, let's see what that person's abilities are, what their end goal is, and let's try a different type of technology. There's so many different things out there that it isn't a one size fits all, and it's okay when things don't work, and that's some more learning that can be shared with other people as well, to say that didn't, but this did.
And especially as your tech provider under sort of Mediquip, especially as a newer member of staff, we're keen to embed that empowerment into the team, Michael, to make sure that you are skilled enough to make sure that that works, because it is very much about positive risk assessment, positive risks to support the individuals at home.
Thanks, David.
I think we're in a really good position. We're obviously members of the TSA, so we're able to kind of draw on your support and expertise. We've got Mediquip Connect as our provider, and we work really closely with them around the opportunities for using tech in new and innovative ways that we perhaps haven't been doing before. And we've got the beauty of the fact that we've now got the LDNA navigators, and I'm working really closely with them to make sure that they're sort of really upskilled, and they are their role is to sort of work with our practitioners around all those kind of have you thought about type questions, and they're really being upskilled at present. And obviously Michael's a shining example of that, of sort of really wanting to embrace tech as part of that approach. So I think we're in a really good position going forward.
I've noticed Ruth's had her hand up, waiting very patiently. Do you want to chip in, Ruth?
Thank you. Yeah, it was just to add to what Natalie's saying, really. So we now have the weekly Learning Disability and Autism peer group discussions. So I've put the link in the chat there. But as part of that, everyone can have, sometimes we've been speaking to practitioners for up to an hour on their cases, a really holistic discussion. And within that, we are going to be talking, thinking about identifying the challenges that you've got and thinking about what tech might support that. So as Natalie just said, we've got Michael, Steph and Sue across Derbyshire areas and this forum. So because I know, Ellie, you've put that you're worried about not keeping up to date with the tech, and that's really, really hard because you're you're juggling a million things. But that's hopefully something that we can take, our navigators can take. And then when you do have a particular case, you can come to the LDA PGD and we can think about potential options there.
I think
we are also going to have our tech advisor starting at the end of October, whose role will not just be supporting in LDA and mental health, but it will be across the board. But her role will be specifically around supporting practitioners to be upskilled and build their confidence around tech, to think about what other tech is out there, to work with you in your team meetings, and to bring tech alive a little bit for you and take some of that mysticism perhaps around it. So we will introduce you all to her as soon as she starts. She's an occupational therapist, so she's worked really closely on the front line as well. So hopefully that will really help to sort of build that confident culture around incorporating tech as part of that wraparound for somebody's care.
I think that'll be a really strong point, Natalie, and we've seen some other authorities introduce that similar role that can definitely help. Whereas I think, coming from Michael's point around how do we just know what's out there, and it is that awareness, but then teamed with going to Ellie's point, but if I'm going to promote this technology, I need to have confidence myself in the technology and understand it before I go and start maybe putting it forward for an assessment. So I think that's great that you're doing that. And I think from a TSA perspective is how can then we work with anyone, whether it's that new role that's coming in, I think it's making sure that we're just on hand to just try and tackle any of these internal challenges that come through, because 9 times out of 10, neighbouring authorities down the road or in Newcastle will have exactly the same challenges. And we just want to be able to really kind of share that across the board. And I think to Ruth's point, it's great to see that peer group. And if there was any, opportunity you wanted TSA to come along to one of those sessions and just maybe reiterate some of the similar conversations from today or share some updates, I think we're always really willing to go to those kind of peer groups just to really share the message that we're talking about today. So let us know if you would like us to get involved, and we'd be more than happy to do so.
Brilliant, thank you. Jenny has asked about the cost of Ethel Care and Abelia. When we're at the point that we are sort of going to bring that to you as practitioners and look at ways of incorporating that in, we will have all the sort of costs around that and how that can be incorporated into somebody's personal budget or into their direct payment. So I haven't got specifics on costs on that at present. I think we've got someone else in the Q&A. Raheem has asked, are there any technologies within the market supporting those with high need, complex behaviours, those without verbal communications, that have been used to promote independence and reduce support? So at that higher end of the care needs.
So I think definitely, obviously, there's a slight blend, and I know maybe Deepak from Ethel Care may have some examples of where this is being used already for those more complex behaviour or complex care needs. So I know some others. One is Cascade 3D. So they have utilised this in some areas, certainly around from a lack of verbal communication. So I believe we've got a case study, so we'll get that over to you, Natalie, and then that's maybe something that we can share around. I know I touched on Care Builder for the Glasgow case study, but they have some, I think, up in work that they've been doing with a housing provider up in Scotland called Blackwood Homes, where that was more around that high level complex care. So definitely worthwhile looking into those as well as the others that we've mentioned on today's call. They're the ones that jump out in spring to mind. Gemma, I don't know if you have any that come to you, or we can kind of take it internally and see if there are any others that's worthwhile sharing. That would be helpful.
I was about to say, I bet David Fuente knows. Go on, David.
Think Smartbox would be my instant one, especially around the verbal communications. They've got obviously grid pad and eye gaze, dependent on physical abilities, but also they've got an app that's one free to trial for 60 days if you've already got a device, but also after that it's only £9.99 a month, sort of privately for it, which is really cost effective. Also, if they have got a speech and language therapist, you can normally go through your local ACT team, access communications teams, to get that funded for if they're really complex.
So I've just dropped all of those three that have been mentioned into the chat there, their websites, if you want to have a look at that. And I'll also drop the Derbyshire and Nottingham EAT team, that's the electronic assistive technology service, into there as well for you. So I knew you were going to be an amazing source of information, David.
He always is. He's fantastic.
Exactly. If
not
nobody
even
has an
covering
answer,
Derbyshire, but I've told him
David
that I'm going to keep picking on him. Yeah, to get his advice.
Me and David used to work together, and I still pick on him now. I'm like, David, tell me everything that you know. He's a font of all knowledge. You're lucky to have him.
Yeah, absolutely. Indeed. Right. Is there something else? There's nothing else in the Q&A. Charlotte's put the smart box in there. Irina, our contract manager, has said the possible barriers are resistance to change, privacy concerns, anxiety, complexity of technology, fragmented services. Tech implementation often requires collaboration across health, housing and social care, and that we used to use brain in hand, but we're not currently using that anymore. But there are obviously a lot of barriers along the way, but it is important to sort of keep those conversations going between health and housing, and really trying to create a collaborative approach around it. And we know that culture change and upskilling staff, building confidence is not an overnight thing, but it's something that we just have to continue to support people in, which is something that we're definitely committed to.
Brilliant.
So if there aren't any other questions, I will just say thank you so much to Charlotte and Gemma for attending today. Thank you, MediQuip Connect, for your input, and any others that have supported on the chat. And if you've got any other questions, then please feel free to drop them over to us, and we will make sure that you all get copies of the slides and the presentation after this. All right. Thank you for your time, everybody.
Thank you so much, everybody.
Thanks, everyone.
Thank
you.
you.
Bye-bye.
Thank you. Bye,
Bye.
bye, bye.
Thank you.
Mark, it says you're called Ellie Hayes.
Yeah, I was just wanting to grab you because I needed to apologise because I was in and out because my laptop was playing up.
Don't worry, it's fine.
Oh, he's gone.
Oh, and he's gone again. Yeah.
He's got a problem with his laptop. Yeah.
Yeah.
Okay.
Oh.
Good stuff.
We've still got the
I'm gonna
AI.
I'll drop the AI.
thing in there.
I can drop them.
And
That's
we've got
fine.
Sue, who is one of our OTs. She's perhaps on a call.
Okay.
So I think you're probably fine to
Yeah, that's
stop
fine.
that and
Yeah,
end the recording now.
that's fine. No worries. And then end the recording. Okay. Job's a good one.